Thank you very much. It's really a great honor to be here today and to be able to present something about the PIP framework. PIP stands for Pandemic Influenza Preparedness, and it's a framework for the sharing of viruses and benefits. Thank you to Wenqing for presenting GSRIS, because PIP really is an integral part of the PIP framework. And so much of what I've said has to be taken in the context of what Wenqing has described. So what is the PIP framework? It's an international access and benefit sharing instrument. It was adopted by the Health Assembly in 2011, following over 4 years of formal and informal discussions and negotiations. It has a limited scope. It covers only what we call influenza viruses with pandemic potential, or IVPPs. PIP is rife with acronyms, so I apologize in advance. But the objective of PIP is to improve global pandemic influenza preparedness by strengthening and improving GSRIS with 2 specific focuses that are to be implemented on an equal footing. The first focus is rapid, systematic, and timely sharing of IVPPs by member states with GSRIS. And the second is access to vaccines and other benefits arising from that sharing by all countries in need, and in fact, by all countries. And the aim really is a fair, more transparent, equitable, efficient, and effective system for pandemic influenza. So why was the framework developed? Well, you have to go back to the early 2000s when bird flu emerged, and bird flu was this high path A H5N1 virus. It spread rather quickly, and it moved from many of the East Asian countries on down through Southeast Asian countries. And there were really grave concerns over an influenza pandemic. Developing countries affected by H5N1 continued to provide viruses to the WHO surveillance network, but they couldn't get access to vaccines. And one country, in fact, stopped sharing its H5N1 viruses altogether with the WHO system until there was a system where all countries in need, particularly developing countries, could have access to some pandemic products, notably vaccines, at the same time as richer, more developed countries. So equity was again at the center of the issue. So what did member states do? Well, they got together. They recognized the priceless value of WHO's surveillance network for both public health and private sectors. They considered some of the gaps in needs for preparedness, but also the critical need for greater equity in a future pandemic response. And so they set about negotiating and really developed a creative and innovative framework to address many of the key issues that had been raised, including 3 in particular. I see that my slides are just not the right size. But anyway, the 3 issues that they really looked at and resolved were: 1, making sure that there was continued access to IVPPs. So member states under the framework are expected to share their IVPPs with GSRIS in a rapid, systematic, and timely manner. And member states do so with the certainty that onward sharing with entities outside of GSRIS will be done in accordance with benefit sharing mechanisms, such as the one covered in the SMTA2. And so that brings me to the second key issue that was addressed, and it has to do with access by all countries to pandemic influenza vaccines and other pandemic response products. And this is done through a mechanism known as the SMTA2. Under that mechanism, all recipients of PIP biological materials, so these are the materials that Wenqing referred to, notably the candidate vaccine viruses, so all recipients must sign with WHO what's called SMTA2, a legally binding contract, under which the signator commits to specific benefit sharing. So for vaccine manufacturers, this is a commitment to provide to WHO in real time, at the time of the next pandemic, at least 10% of their future pandemic influenza vaccine production. The next thing, which you can't see, has to do with strengthening preparedness. And this was, again, a concern that the PIP framework addressed rather creatively. And the idea was to make sure that there were funds for WHO to support capacity building activities in countries where they're weak. So they put in place something called the PIP Partnership Contribution. This is an annual cash payment by manufacturers that use GSRIS, and they pay those funds to WHO, and WHO then has capacity building projects in countries where capacities are weak, and they also set aside some of the funds for pandemic response. So finally, member states, what did they do? They broadened the responsibilities of the surveillance network, and they broadened them to include response, and they gave the network a new name, GSRIS, so that finally we went from just a surveillance network to really a global system that really brings together member states, GSRIS, WHO, and industry in a real sort of virtuous circle here of surveillance, sharing viruses, doing the analyses, developing CVVs, coordinating and promoting virus sharing, contributions by industry in the here and now through partnership contribution, and for the future as SMTA2s, and that work is coordinated through the PIP framework, by which we WHO secures real-time access to future pandemic vaccines and has funds to strengthen preparedness. All of this partnership is really quite important to the way the system functions. So where are we now? I'll go through this very quickly. Benefit sharing under the PIP framework is really facilitated by clear expectations, and I think that is one of the lessons that is important for us at WHO. There are tools to track and monitor the sharing of materials, and we can get into those if you wish. But in terms of what the benefits have been secured, we have secured through the SMTA2s, we've signed with all of the large vaccine manufacturers agreements, and we will have access at the time of the next pandemic, 10% of future pandemic influenza vaccine production as it rolls off of the production line. This is the real-time access, and it really is a critical feature of this. The agreement is with WHO, so the vaccine would come straight to WHO, and WHO would be able to allocate it to countries based on public health need. We also have diagnostics and syringes under these contracts, and a number of other agreements have been signed. In terms of the partnership contribution, we've collected upwards of 270 million from manufacturers that use GSRIS. This is really a testament to the staying commitment of industry to the PIP framework and what it stands for, and to the partnership that exists with GSRIS and with member states. We, in terms of, oh, thank you very much. 1 minute. So we've increased preparedness capacities through our work with regional offices. We've worked in over 85 countries to develop the different capacities, strengthen different capacities that are essential to preparedness, be it planning, lab and surveillance, regulatory risk comms, developing burden of disease studies, or planning for deployment. We produce detailed reports every 6 months. We work on a biennial cycle, and really, this is a global team that is implementing a global program across all of the regions and across HQ. The PIP Framework Governance, I won't go into it too much, but I think it is important to say that there is a 3-pillared oversight mechanism, World Health Assembly, DG, and the famous PIP Framework Advisory Group. This is an invaluable group of members. 18 of them come together twice a year. They provide assistance to the Secretariat, that provide guidance to the DG to strengthen the functioning of GSRIS. And in that sense, they are really an invaluable asset to the PIP framework implementation. Changing global context challenges. Some of you will go into this in your other presentations, but two important developments that really have set the landscape for the future of PIP. One has been the entry into force of Nagoya Protocol and the growing number of countries with access and benefit sharing legislation. These raise broad questions about the implications of access and benefit sharing legislation on the sharing of seasonal influenza viruses. And Wenxing mentioned that already, in particular, the sharing of seasonal candidate vaccine viruses with vaccine manufacturers. And the other big challenge in the global landscape is the increasing use of genetic sequence data. This really raises questions about how to develop a fair and equitable access and benefit sharing system for access to and use of genetic sequence data. That's my last slide. Here is just some key links, and thank you.